I have sent the message.
आज डॉक्टर तंगवेलु जी नहीं आया?
जी आए नहीं, मैंने मैसेज किया है.
I think everybody is on this 30 minutes advancement. Anantakrishnan ji has come.
Hello.
Yes, Anantakrishnan ji, welcome.
Thank you so
we are
much.
able to hear you, but we can't see you.
Okay. So out of sight, out of mind, they say, So
Very nice.
Thank you.
Good evening.
Namaskar. Namaste ji.
Namaskar. Good evening.
Welcome,
sir. At currently, which country you are in, sir? Anantakrishnan ji.
I'm in Morocco.
You are in Morocco right now.
Yes.
Okay.
And is Ambassador Ali said he's also joining?
Yes, he's also joining.
CG, here, CG, please start.
Okay. Namaskar, very good morning, friends. And on behalf of Canada India Foundation, I extend a very, along with all our partner organization, a very warm welcome to our weekly virtual speaker series on Ayurveda, the pharmacological and therapeutic effects of top 75 Ayurvedic medicines. And today's fifth session, and the topic is on Kanchanar, Guggul. And we have a very special guest with us this morning. And I extend a very warm welcome to a very special welcome to Mr. Anant Krishnan, Secretary General of Urban Economy Forum, and who has been serving as the senior advisor to United Nations as well, with over 3.5 decades of experience in international development work, including with the UN, and his passion for the youth empowerment, policy and research, and the program management in various areas is commendable, sir. We are very honored to have you with us, and your current involvement at the as a senior Secretary General of Urban Economic Forum, where focusing on the sustainable urban development. Sir, we are very much eager to learn from you. I know you've been in Toronto quite a few times. We have our base in Toronto, and we are looking forward to interacting you in person whenever you are next in Toronto. You've been traveling all across, and we were very eager to meet you and learn from you and gain some of your wisdom. And this initiative, which Canada India Foundation, along with other partner organization, has started, that how Ayurveda, the ancient wisdom of India, can help every mankind in preventative disease management side. And we're looking forward to your help in that. And also, friends, we have another special guest. I think he will be joining shortly, Ambassador Ali Saad Faki, who is the Somalia's ambassador to European Union, a scientist with a PhD in toxicology, and with a very extensive research on preclinical drug development, with a specialty on reproduction on birth defects. And again, we are very proud and very honored to have our both special guests and our speakers of today's discussion, Professor Dr. Anjana Dwivedi from Lucknow, and also Dr. Shilpa Yerme from Sholapur. We extend a very warm welcome to you both as well for taking time out to join on this important session. And we're looking forward to very engaging presentation. And a special thanks to, as usual, to our Narenji for helping us in, week after week, bringing so accomplished speakers and our special guest on this forum. Special thanks to Narenji. Over to you, Dr. Verma.
Thank you, CG. Thank you very much. And first, I invite Narenji to invite Dr. Anant Krishnanji and introduce him on the dais, and then we will take the technical session later on.
Yes, thank you very much. Good evening to all. So I'm from India. I think this is a great initiative, collaboration of medical practitioners across North America, Europe, India, and literally the globe Ayurvedic practitioners. I think this all started off with our narrative of calling this the traditional Ayurvedic medicine and focus on building a network of thought leaders and global personalities who can tell us how to make this really global, because we passionately believe that Ayurveda has it in his core solutions which larger mankind faces today across geographies. So in that process today, our special guest is Mr. Ananthakrishnan. He's like personally to me, he's like a friend, father, and philosopher. We interact a lot, not necessarily on specific subject, but I think Ananthakrishnan ji, just like his profile Satish ji read about, he's a man of global experience, though he's originally from Bharat, but I don't think he's seen Bharat much at all. So his Bharat is we few whom he interacts, maybe. Otherwise, what he reads in world affairs and public news. But most importantly, he's worked with global institution. He's built global institution. And he's a person who understands geopolitics. He understands the diplomacy of economics, the diplomacy of health, and the diplomacy of currently the Urban Economic Forum. So he has a world view. It will be a great opportunity to take this subject. When I reached out to him, even though he's my dear friend, but he was very passionate about Ayurveda. So, and it will be a great personality because we come from a technical and professional background. Listening to him would enlighten us and it help our mental horizon widen so that collectively we are able to make a difference to human endeavor across the globe. So with that, I request Mr. Ananthakrishnan to tell us and what he thinks is has any experience and generally how does one make this really a global initiative, sir?
Thank you very much, Narendran ji. It is indeed a great pleasure for me to be here with you all, and with Satish Thakur and Dr. Verma and other colleagues here. And so, of course, the introduction was quite, a bit exaggerated, maybe. I'll try to be very brief also because within an hour's time, you have so many speakers today. So, as I said, thank you for inviting for this 5th session on the pharmacological and therapeutic effects of 75 top Ayurvedic medicines. As mentioned before, I'm the Secretary General of the Urban Economy Forum based in Toronto. And the Urban Economy Forum, or UEF, we, in partnership with the Canadian government, that is CMHC, and UN Habitat, which is the United Nations Agency for Housing and Urban Development, and Daniels Corporation, which is a private sector company, has set up the World Urban Pavilion in Regent Park. Of course, for those of you from Toronto, you know where Regent Park is. The pavilion is a knowledge exchange hub or sustainable development and sustainable urban development in particular. So here I would just like to briefly touch upon the link between sustainable development goals, traditional medicine, and Ayurveda. Sustainable development goals, as you know, are SDGs. They are a set of 17 goals with 169 targets. So it's called Agenda 2030. So by 2030, we should be achieving these goals for peace, prosperity, and development. The UN envisages a holistic approach to achieving these goals by focusing on humankind and planet. There are, of course, a lot of scientific literature, technical reports, international bodies such as the UN FAO, Food and Agriculture Organization, World Trade Organization, UNESCO, and not the least World Health Organization. We always mentioning about the traditional ethnobotanical knowledge. So the literature on traditional ethnobotanical knowledge was mapped with the targets of SDGs to determine the role of traditional knowledge in the realization of selected goals and targets. So what we need to be doing is that link up the UN goals and how the work that we do in the case of Ayurveda and traditional medicine indeed assist the humanity in achieving the SDGs. So, in an extensive extensive and systematic view of available literature says that the 17 goals are associated with the traditional medicines as well. So one of the 17 goals that is called SDG 3, Sustainable Development Goal number 3, aims at reducing mortality and improving global health, especially for pregnant persons, newborns, and children. So it promotes eradication of epidemics and communicable diseases, better prevention and treatment for narcotic drugs, alcohol, and tobacco consumption, and reducing road traffic accidents. So SDG 3 has a number of sub-themes, as I said. It also promotes the implementation of universal health care for sexual and reproductive health and access to affordable and essential medicines for all. So I think in this regard, we must also look on what is our strength here. So the idea is that benefits and services that nature provides, or biodiversity and ecosystems provide our health, and largely they are unrecognized, unappreciated, but they have tremendous impact on our well-being and daily lives. So moreover, the recent pandemic has shown that even in industrialized countries, or so-called developed countries, they're not prepared to control the spread of viral infection. Neither have their populations developed immunity to fight against such an infection as well. So since many of the traditional medical systems focus on prevention rather than cure, the traditional medicine could be the way forward to combat communicable diseases in the future and ensure general wellness. The role of Ayurveda and traditional medicine in healthcare has been recognized by various governments, not least by India, and international organizations. So the World Health Organization acknowledges that traditional medicine has a long history of use in health maintenance, disease prevention, and treatment. So of course, what I'm talking about? Human health, yeah? Human health is what? Ultimately depends on ecosystems, the systems that we live in, that provide goods and services that underpin a healthy life to maintain people's physical and mental well-being, such as what we need is food, fuel, shelter, income, clean water, places for recreation, relaxation, and sacred spaces and cultural sites. So as we all know, India is the second biggest exporter of medical and aromatic plants, yeah? Of course, after China. So out of which, about 6,000 species are found in India's territory alone, and 90% of these medical plants grow in India's natural forests. So when we talk about Ayurveda and medicine, we also have to think about where do they come from, They come from nature, natural forests. It was estimated that around 65% of the population rely on traditional medicines based on these plants of what was a primary health care, And suppose if you feel cold, immediately you take a glass of ginger water or pepper or whatever it is, for example. However, these species are highly threatened by deforestation and unsustainable harvesting. While growing demand for these products and incentivizing further poaching and overexploitation, we see that illegal trade in these natural products are to be found. So actually, what according to the statistics, 316 medical plants, including globally significant medical plants, they're called GSMPs, globally significant medicinal plants, were estimated to be under threat of extinction in India. So I would sincerely hope that while we focus on different achievements in Ayurveda and Ayurvedic medicine, it's also important to see the root or the source of these medicines are not being lost. Forests are being kept and biodiversity is maintained. So far, this has been extremely so. For example, many have been extremely successful in this sustainable use of these plants. And it is also protected. One was able to protect and spread the knowledge of traditional healers while raising awareness and capacity of medical plants. So once, for example, the current COVID, epidemic is taken care of, we should have no stones unturned to repair the damage and move towards the global of universal health care. These are, I think, what we need to be thinking about, yeah? And in this regard, the traditional medical systems can play an important role and help us achieve the Sustainable Development Goals, namely health, and we're talking about well-being of all. And so while traditional medical systems are already getting popular across the globe, it's important that due recognition is given for the legitimate healthcare systems. They're not discriminated for R&D. Very often research and development, we have to get scientific state-of-the-art facility for that. And so that, for example, prevented us from doing further work on COVID-19 affected, for example, India. It's also important that different healthcare systems are not looked in isolation, yeah? But countries should rather move towards an integrative and holistic system. So healthcare were those who treat, we call them what, doctors or vaidyas, as well as patients, can make informed choices among the opinions available to them. So that's why, I mean, like, for example, medical insurance to also take care of how a traditional medical system can be supported by that. So there again, when it comes to biodiversity, the number of EU agencies working for them. There is this Global Secretary for Biodiversity, which is based in Montreal. Then I've got UNDP, United Nations Development Program. They had a project in 2014 where they helped around 50,000 households to set up home gardens for the cultivation of medical plants as a result of training and awareness campaigns, including the distribution of seeds. So that's, I'm talking about Chhattisgarh, yeah? In Chhattisgarh state, which normally uses about 11% of the household income for medical care, they were able to save at about 13% of household expenditure because of this traditional medical system. So then WHO has, that is WHO stands for World Health Organization, stands for, it also has recently established what is called the Global Center for Traditional Medicine, which all of you know. It's a knowledge center for traditional medicine. As a part of WHO's overall traditional medicine strategy, it is a focus on evidence and learning, data and analytics, sustainability and equity, and innovation and technology to optimize the contribution from traditional medicine. So what's important is that we have to understand about, learn, use data analysis and innovation. At the same time, you also need to pay respect to local heritage and the rights of people who are in charge of local knowledge. So I agree with the view that we have to stress the need for closing the gap between social and medical sciences. So medical sciences are often many in our countries treated in a pedestal. That is something very difficult to get medical education. So you treat them separately without doctors having to know how to treat a patient on a one-to-one basis. So what I'm saying here is that we need to close the gap between social and medical sciences in order to reach a better understanding of health needs of the population. The main task of Ayurvedic medical researchers in India and other regions, including, for example, North America, Canada, and Latin American region, is to work towards the creation of what people call as a bio-socio-cultural model. That means you have to understand biodiversity, in what social context is there, and the cultural context. An attempt to enrich systems qualitatively for the development of more humane and efficient interventions. Now, the government of India, I think, established, I think last month, whenever it's recently, a WHO Center for Traditional Medicines that reflects the WHO's vision that harnesses the potential of traditional medicine would come together for health for the benefit of all. So the difficult issues surrounding traditional medicine has a reason of lack of respect for traditional knowledge systems, including communities. Like for example, in Latin America and in Canada, indigenous people, or the First Nations, what you call in Canada, they were the custodians of traditional medicines. And failure to respect that carried legal and practical implications. So the question of intellectual property rights that WTO talks about, it is clear that the role of traditional medicine in meeting the health needs of populations have now been recognized. It should be understood in terms of complementarity. I'm not saying that we forget whatever we have of modern medicine, Western medicine. We have to talk about complementarity. Modern medicine, in large measure, are able to reproduce benefits of traditional medicines. What we see is isolated, the plant ingredient is isolated, and it is manipulated, reproduced in a laboratory, then sold in colorful tablets and blister pack. They all come originally from traditional medical resources. On the other hand, governments and international communities should regard everyone's access to unprecedented opportunities offered by modern medicine as a moral and political obligation. So the First Nations, for example, in Canada, which all of you know, there is Anishinaabe, one of the major groups of First Nations, mostly in Ontario State. The teachings of 4 sacred medicines, that is, they talk about promotion of dialogue and exchange between the First Nations medical system and systems such as Ayurveda. It's important. Are we communicating? Are we communicating the local medical system with indigenous people of First Nations? Or we are saying that our medicine is the best? It's important. It can enrich the knowledge base and help humanity. This also can be a safe approach towards the utilization of plant-derived medicine, or what you call it, phytomedicines, yeah? Because nearly about 900 medicines from Ayurvedic medicine comes from plants and trees. And so it needs to be trained researchers and Ayurveda practitioners, traditional healers. So in the Indigenous Peoples Declaration of 2009, clearly underlines the right of indigenous peoples' enjoyment of the highest attainable standard of physical and mental health. For too long, their traditional knowledge and medicine have been overlooked and undervalued, the same way as Ayurveda has been. There's a great deal of evidence to show that indigenous health systems work and the state of the health-run care can benefit greatly from developing intercultural models which are based on both traditional and modern healthcare systems. My message is, based on the Sustainable Development Goals of the United Nations, with SDG 3 on health as a basis, we should try to create linkages and understand each other of different various traditional medical systems available in the world and see how Ayurveda can be enriched by this and how Ayurveda can enrich these systems so that ultimately, the whole family of nations can benefit from this process. Thank you very much indeed.
Welcome, sir.
Thank you so very much, Krishnanji, for very, very thoughtful sharing your insight. And just want to add here that at Canada India Foundation level, we are working very closely with Ushna Virya. You mentioned just recently, and recently we celebrated International Yoga Day together. And our theme was Yoga Day, Indigenous Way. So we've been working very closely with them, and we're looking forward to, whenever you're next in Toronto, looking forward to your guidance. As Narenji said rightly, that bringing or creating an ecosystem, a holistic ecosystem where these discussions can happen, which is happening through this platform, and we all gain from there. Dr. Verma, over to you.
Thank you, CG. Now, Dr. Madan Thangavelaji have joined. I request Dr. Madan Thangavelaji to moderate the session further, because and we have Dr. Ali with us. Narenji, if you can introduce Dr. Ali, then after listening from him, then we'll start the technical session.
Thank you very much. Dr. Madan has come, so the original is there. So do we need the fake to introduce again? So, Dr. Madan, you want to start and introduce our chief guest today, sir?
Thank you very much. Very happy to be here with all. Thank you for joining us on this event today, discussing the benefits of traditional Ayurvedic medicines. Our idea in these programs is to bring to the world what we are calling traditional Ayurvedic medicine. These are formulations with a very old and a long tradition that goes back to thousands of years. They have benefited people, they continue to benefit people, and they somehow are not appreciated in their fullest. And we're very fortunate to have, we've just listened to Ananta Ji, and we're very fortunate to have Dr. Ali Said joining us. Good afternoon, sir. Very delighted to have you here with us today. And looks like you're joining us from somewhere very, very beautiful with palm trees in the back.
Yes. I'm in Somalia currently. And thank you both very much for inviting me. As I'm actually a safety scientist, a toxicologist, who practically does the safety of drugs. And, as you know, the drugs can be from chemicals, biological, and plants. And, this is the field that I study a lot. I do research on these areas. Plants have produced a lot of medicine origins from, there are many drugs that are origin from medicine, but really, the extractions, direct extraction from plants, so far there are only 2 plants that have been approved by FDA. The rest are all synthesized compounds that came originally from plants. The development of drugs directly from plants poses a lot of difficulties due to the nature of the compound, the constituents of the plants itself, and the purification and conservation as well. So, but this is an area of high potential interest even in the industry. People are looking lots of, there are lots of untapped resources, plant resources that are available for medicine, traditionally used in India and the rest of the world. So I'm very pleased to be joining and listening you on this particular subject on this plant and on this session. Thank you very much.
We are very fortunate. Before we let you go, Your Excellency, we are very fortunate to have somebody like you who's a veterinarian and a diplomat, and with a lot of experience in diplomacy, plus the veterinary sciences and toxicology. Now, a question to yourself, which is the work that goes on. You have seen, you did your PhD in Leipzig, etc., and you've seen how the world operates. In India, right at this moment, there is an establishment of a World Health Organization's Global Center for Traditional Medicine. And this is a new initiative that requires skills of somebody like yourself, diplomacy plus technical skills, plus understanding the psychology of people of the world and their needs. We wish very much from you a little bit about the traditional systems of medicine in Somalia and in the neighboring countries, and the kind of mood there, particularly the larger Africa in terms of traditional medicine. WHO has its Africa office in Africa, and we will just want to hear from you what you hear through the grapevine about these kind of developments.
It's the plant, the medicinal plants, the traditional medicine in Africa is a rich medicine. People have been using for centuries and centuries, but realistically, it is so difficult. There is, as you can imagine, scientifically, it's still unexploited because there is no funding available for this kind of research. But people have been using traditional medicine for a long time. There has been, one phase that has been completed for the fact that I know is at least the classifications of the plants of traditional medicine in Somalia that are available. They have been classified and stored and conserved. I know there are several books that have been published about the medicine or plant medicine of Africa, in the North Africa, in the sub-Saharan regions, in the West Africa. There are many of those books available. The plants are there. But the fact of the matter that, for what I know, is still in a very early phase. Maybe the introduction of the WHO creating this global center for traditional medicine will help a lot. But so far, I think it's the beginning of, there is not much development that took place. The industry, the pharmaceutical industry that have interest in this kind of, raw materials, they are themselves are not much into this. But we hope now for that the center may bring lots of potentials, may bring interest into the field. And we hope that Somalia and many other African countries will benefit out of it.
Your Excellency, your position as ambassador also to the European Union is very special. And it's a privilege to have you here because you know how the world works at that level where governments interact, countries. And we want a last word from you about how we might even be able to visualize an interaction between Africa, Somalia, the European Union, and India. India's scholarship in this area is thousands of years old, like what we are discussing. We would like your guidance on whether we are doing something that can be done better. We feel we are doing something that's in the right direction.
I have worked with Indian pharmaceutical companies. I've worked with Indian scientists for several years. I think India is well equipped in this area. The one thing that I think it needs is, first of all, is a political interest. When there's a political willing and the potential is there, I mean, we need to start cooperation between India and European countries, between India and Africa, and between India and the pharmaceutical companies, so that there is such an interest. Because I have written a chapter on botanical development of botanical drugs in the market, and they are still certain difficulties that are facing this industry, particularly the way, because as you know, a plant has several active materials, and it's very hard, and it changes depending on the season and depending on the body of the trunk and the flowers and the seeds, and is the principal active materials could be variety, and it really needs, we need an approach on which to benefit much of this wealth that the world has given us, that God has given us, so that we can benefit out of it. But what is important, I believe, is that we need to establish cooperations between different entities, so that this global center takes the direction of changing the traditional medicine from a dormant position to a very active and resource providing materials that that can be used to the health of the human being.
Your presence here today, Your Excellency, is very important for us for several reasons, particularly your presence as ambassador to the European Union and the relationship with Somalia. And I hope in the days to come and the months to come, we will have many more interactions outside the context of today's event, and you will guide us in how to think about this better. The Ayurvedic system has a different worldview that is consistent with the United Nations Sustainable Development Goals. And using that vision, we are able to see the role of plants in human health slightly differently from the reductionist approach, but we will discuss that in the course of time. Thank you very much for being with us today. We are delighted and honored that you could join us today. Namaste.
Thank you very much. Thank you so much. You're welcome.
Harishji, we are very honored to have His Excellency Ali here with us today. He's such a learned man with a lot of background in areas that are important for us, and being ambassador to the European Union gives us all an opportunity to engage with him a little more, to learn. Thank you.
Yes.
I think we are, if all of us are ready, then we should proceed to our main program. Harishi, is that correct?
Okay, sir. Thank you very much. Viewers, today we will have a discussion on a very special polyherbal traditional medicine, which is called Kanchnar Guggul. And Guggul preparations, Guggul formulations are very challenging in Ayurveda because Guggul is a resin. We use the resin, we use the gum of a plant which is called Commiphora mukul or Guggul. And over the period, the researchers found that the disintegration is a challenge. In Ayurveda, in traditional Ayurveda, there was a method to at least hammer 1 lakh times, then only it can be used as a medicine, and then it can be absorbed through the gut. But we have a special guest, Dr. Anjana Dwivedi ji. She has done her PhD how to improve the disintegration time of Guggul preparation. It's a very special information. Nobody knows it. The information are lying in the institutions. Now we are trying our best to bring out all the informations and making it available to the public. And Dr. Anjana Dwivedi ji enlighten us how the Guggul preparations can be manufactured without wasting time on hammering for 1 lakh times. So over to Dr. Anjana Dwivedi ji. Thank you.
Thank you. Thank you very much, sir. First of all, I would like to say thanks to the entire organizing team of this event, especially Dr. Harish ji, for providing me this opportunity to share my views regarding traditional Ayurvedic medicine on this platform. Thank you, sir. So, group of formulations containing Guggul as a major ingredient is known as Guggul. Since Kanchanar Guggul contains 50% of Shuddh Guggul, so this formulation also comes under Guggul.
Please share your presentation. Your presentation is not available to us.
Okay, okay, sir. Now is it okay?
AG, not yet.
So, group of formulations containing Guggul as a major ingredient.
Madam,
sorry.
Anjana ji, your presentation is not visible.
It is not showing, sir.
AG, perhaps you need to.
Okay. One minute, sir.
Perhaps, apologies for this delay.
Share my screen.
Thank you, ma'am. Anjana ji, if.
Is it okay, sir?
Oh, very good. Thank you. Very nice. Thank you very much. Please.
Okay. So, group of formulations containing Guggul as a major ingredient is known as Guggul. Since Kanchanar Guggul contains 50% of Shuddh Guggul, so this formulation also comes under Guggul. Guggul is an oleogum resin of Commiphora mukul of Berseraceae family. So it is very sticky in nature, and when it is repeatedly hammered by the process of puttanam to prepare its pills, its particles further bind up with each other more firmly, affecting the disintegration of pills very adversely, resulting in delayed disintegration of pills into the gastrointestinal tract. Also, it is the experience of physicians that on administration of Guggul containing pills, they expel out through fecal matter. As such, without getting disintegrated in GI tract. Hence, patient is asked to crush the pills within his mouth before swallowing. So I personally worked on this problem during my own postgraduate and doctorate study time at Institute of Medical Sciences, Banaras Hindu University, Varanasi, under the able supervision of my mentor, Professor S.K. Dikshit and Professor C.V. Jha sir, and found that some factors affect adversely the disintegration time of Guggul containing pills. Amongst these factors, one prominent factor is the medium or material used for shodhan, that is Ayurvedic purification of the Guggul. Second main factor is the process of puttanam, that is repeated hammering of Guggul prior to make its pills. If some pharmaceutical modifications like use of certain additives during the pills are adopted, it was found that the disintegration was enhanced by reducing the disintegration time. Now, if we take the first factor, that is shodhan of Guggul, we found that many Ayurvedic literatures have mentioned various types of mediums or materials for this purpose, like Dashmul Kwath, Gulchi Kwath, Trifla Kwath, Godugdh, Gomutra, and Panchtik Kwath, etc. Out of which I found Gomutra and Trifla Kwath were best in relation to disintegration time of Guggul containing pills. Likewise, the second factor, that is puttanam, is not good for disintegration, but it is good only for smooth and elegant appearance of pills. During my experimental study through tablet disintegration test machine, I found that Guggul pills made after puttanam were not able to disintegrate at all, even after 12 hours, because due to repeated hammering, the cohesiveness and stickiness of Guggul went on increasing, ultimately resulting in much more firm binding of the material, leading to no disintegration. So I modified the pharmaceutical procedure on several steps, like granulation of that material and formation of pills, as well as formation of tablets. Again, formation of pills and tablets after adding some additives. The additives were planned in such a way that the main action of drug will not be altered. So for this purpose, I selected 3 types of different additives. Firstly, the powder of Dugdh Pashan, that is talc, also known as hydrated magnesium silicate containing small amount of aluminum silicate. Second one was sodium bicarbonate, and third one was the powder of major herbal ingredient of that particular formulation itself. This modification gave better results and reduced the disintegration time of pills from 12 hours to 3 to 4 hours. Here are some synonyms of Guggul. Their individual meanings provide us many informations regarding Guggul. As time is short, so I am not going in detail. Only one synonym, palankash, I would like to explain, which denotes that palam mansam kashati hinasti iti palankasha, means that which reduces the mans or bulk of the body is known as palankash. This meaning of palankash is justified through the lekhan and karsh, that is catabolic qualities of Guggul. On the other hand, Guggul is Branghan and Vrash, that is anabolic also. This difference lies upon the age of Guggul resin. The freshly collected, that is new resin, is anabolic in nature, while stored resin, that is old resin, is catabolic in nature. Here in this slide, I tried to explain the qualities of new and old Guggul. Therapeutic dose of Guggul is 4 to 12 ratti, that is half to 1.5 grams per day. As per Bhav Prakash Nigantu, During its consumption, one should avoid sour and pungent diet, alcohol intake, overeating, physical exercise, sun exposure, and emotion like anger. Acharya Bhagavath has mentioned in Ashtanga Sangrah about several side effects of Guggul also, if it is used in excessive amount for longer period. These side effects include refractory error of eyes, dryness of mouth, impotency, emaciation, perplexity, insomnia, laxity, dryness, and roughness of body. During my research work at Banaras Hindu University, Varanasi, one of its side effects, impotency, has already been proven on the experimental animals, that is albino rats. I tried to discuss here in short all about Guggul first because it is the major content of Kanchanar Guggul. Now, here is the composition of Kanchanar Guggul detail as per Shar Samhita. It contains Kanchanar Tvak, that is Vohinia variegata of Leguminosae family, Haritaki, that is Terminalia cebula of Combritaceae family, Vivitaki, that is Terminalia valerica of Combritaceae family, Amalaki, Amlica officinalis of Euphorbiaceae family, Shunthi, Gingiva officinale, Gingivaraceae family, Marich, Piper nigrum, Piperaceae family, Pipli, that is Piper longum from Piperaceae family, Barun Tvak, that is Cretiva of Caperidaceae family, Ela, Electeria cardamomum of Gingivaraceae family, Tejpatra, that is Cinnamon tamal of Lauraceae family, and Dalchini, Cinnamon gelanicum of Lauraceae family, and after all that Shuddh Guggul, that is 50%, Commiphora mukul, Burseraceae family. Here the quantity we can take Kanchanar Tvak 40 parts, Haritki, Vivitki, and Amalki, each 8 parts, Shunthi, Marich, and Pipli, 4 parts each, Barun Tvak also 4 parts, while Ela, Tejpatra, and Dalchini are 1 part of each. And equal to all these ingredients, Guggul is there, that is 83 parts. This slide is showing the photos of all raw ingredients of Kanchanar Guggul. As per Sharangda Samhita, the therapeutic dose of Kanchanar Guggul is 1 sharn, that is 3 grams daily, which should be taken once in morning only with any suitable prescribed adjuvant, like either with decoction of Spheranthus indicus, or with decoction of Acacia catechu, or with decoction of Terminalia cebula, or with simple lukewarm water. Kanchanar Guggul is therapeutically used to treat Gandumala, Apachi, Arbud, Granthi, Bran, Gulm, Kusht, and Bhagandhar, which may be correlated to goiter, scrofula, tumor, nodular enlargements, wound, lump, skin diseases, and fistula in ano respectively. As far as the clinical experience is concerned, I am in academics only, so not an experienced person, but my friends who have relevant experience in this field, according to them, it has very good effect on soft tissue cysts and ovarian cyst. It is observed that cyst starts reducing in size after 1 to 2 months of treatment, and often eradicated completely on long-term therapy. Besides this, it is also good for treating the inflammatory conditions like swelling of joints. Better results are obtained when it is administered in empty stomach. In terms of Ayurveda, it exhibits its action due to its kapha-shamak quality. But in terms of modern pharmacology, the probable pathway for pharmacological action need to be explored by the researchers. Here are some already published article on Kanchanar Guggul. This is regarding characterization of its phytochemicals and validation of antioxidant and anti-cancer activity. This one is on scientific evaluation of antioxidant and anti-cancer activity of Kanchanar Guggul vati by in vitro methods. This is regarding the cytotoxic and anti-proliferative activity of Kanchanar Guggul. And this article is related to its LCMS metabolomics profiling. So it is all about the Kanchanar Guggul in short. Thank you all for listening patiently. Thanks.
Professor Anjana, thank you so much for introducing us to the innovations that you've brought about. Kanchanar Guggul, as we've seen and what was described in the flyer, is a very powerful oleoresin that comes from this plant, and there are issues related to purifying and how you purify this. And Dr. Anjana has told us a little bit about this. Let us listen to our next speaker, who's going to tell us how this formulation can be used as therapeutic interventions. We are delighted to have here Dr. Shilpa Yarme joining us from Maharashtra. Shilpa ji, thank you very much for joining us today. We look forward to hearing from you. There are questions coming up in the chat box already about dosages extra, but we will take that in the question answer session. Thank you again for joining us today from Sholapur. Thank you, Ji.
So, good morning to one and all. It's really a great pleasure to be here with all of the stalwarts of the Ayurveda, and I'm very much thankful to the organization. And without wasting much time, because we need to discuss the various points regarding this Kanchanar Guggul. It is a wonder drug, and really it is a great pleasure to present with this Kanchanar Guggul. So let's have a discussion with Kanchanar Guggul and how it is beneficial in the various diseases of day-to-day practice. Because in Maharashtra, we are using this wonder drug routinely, very routinely we are practicing it. So Kanchanar Guggul is a compound Ayurvedic formulation available as a spherical peel or vati form. It's a black or brownish black in color and has an agreeable distinct odor and a bitter taste. It is listed in the Ayurvedic Formulation of India and the Ayurvedic Pharmacopoeia of India. So as per the classical references, this Kanchanar Guggul is mentioned in Bheshaj Ratnavali. Bheshaj Ratnavali in Galaganda Gandamala Apachi Granthi Arbud Vikar. Kanchanar tree, Ushna Virya is a deciduous tree that is native to India and China. It is majorly found in the Assam, Eastern, Central and South India. The bark of this tree has multiple medicinal uses. It is a very good reserve of vitamin C, iron, calcium, magnesium, vitamin B, as well as dietary fibers, proteins and carbohydrates, rich in bioactive chemicals and that have strong antioxidant, anti-inflammatory, anti-tumor, pain relieving and detoxifying properties. So Kanchanar Guggul rectifies thyroid issues like goiter, blood clots, irregular periods, overweight conditions, and all the other conditions like the skin disorders. This Kanchanar Guggul contains, there are 12 different type of constitutes or drugs like this Kanchanar, Haritaki, Vipaka, Amlaki, Shunthi, and Maricha, Pipali, Varuna, Ela, Twaka, Tejpatra, Guggul, Shuddha Guggul. So these all are the 12 compounds or constitutes drug which combines with this formulation Kanchanar Guggul. So this medicine is made up of all this. So I think whenever we are looking with the different conditions, we have to take consider to all these contents also, because there are wonderful herbal formulations, wonderful herbal drugs like Triphala and Katu is there. So Shunthi, which is the Vishwa Bheshaj known as Varun, which also acts on the various conditions like arbut, tumor, and Ela, which is a spice also, and Ela is really a good drug. Twak is also a good drug of choice. So these all are the contents. This is the classical reference of Kanchanar Guggul. Kanchanar Guggul help balances kapha and reduces Meda dhatu. So I think the main concern of this Kanchanar Guggul, how it acts is it acts mainly on the kapha and vata balance, and it is effective in reducing the swelling in the neck and goiter. Kanchanar Guggul is having the properties like it is ruksha, laghu, and Ushna, which is having the hot potency. So all the properties like Dipan, Pachan, Vata Kapha Nashan, Shothar, Lekhan, Bhedi, and due to all such type of properties, Guggul acts as an anti-inflammatory potent. It is a very potent anti-inflammatory Shothar effect. It is a therapeutic which is used to treat in the gulma, abdominal lump or distension, gandamala, apachi, or granthi, varana, or kushtha, bagandhar, sleeper. All these are the conditions. This is just a chart because this Kanchanar Guggul is highly effective in all these conditions. And we are in the next, my PPT and presentation, I am going to discuss all these diseases. So this is a short review of the Kanchanar Guggul. Classically, there are such things are there like Galganda, Granthi, Apachi, Vrana, Gulma, Kushta, and Bagandhar. Classical indications for Kanchanar Guggul are some of these. Like Galaganda, which is the cervical lymphangitis, Granthi, tumor, Apachi is known to be fibroid, Vrana is ulcer, and Gulma is like abdominal distension. Thyroid disorders. I think nowadays thyroid disorders are very much common. How it works? Kanchanar Guggul aids the thyroid by regulating the thyroid hormone secretion, and it helps in the treatment of both types of thyroid disorders. Especially, it works in the condition like hypothyroidism. Galaganda and Gandamala are correlated with the thyroid disorders, and Kanchanar can be used due to its anti-cancer, anti-tumor, and immunomodulator properties. Kapha and Vata dosha are the important factor in the pathogenesis of Galaganda and Gandamala. So according to the Ayurveda concern, as we always look with the dosha dusha samochana, and here are the doshas which are involved in the thyroid conditions. So I think as we have already discussed the properties of Kanchanar Guggul, that it is ruksha, kashai. So this rukshata and kashai are like scrapping property of this Kanchanar helps in the Galaganda and Gandamala. So it is a wonder drug in this all disorders. And very known condition nowadays, I think the cancer or tumor is very growing. It is like pandemic in the society. So this formulation is used in clinical practice to treat benign and malignant tumors. So I think if we use in the starting phase of the tumors, it will really effective in cancer. So here is, I am just shared the screen with the nidan of pathogenesis of this tumor or arbud cancer. The main factor for the imbalance is Agni imbalance, and due to the imbalance of Agni, there is formation of ama. In allopathy or in modern concern, I think it is correlated with the toxic substances. So ama is known to be a toxic substances which imbalances the dosha, and it again leads to the dhatu and srotas dushti, and this again develops into the cancer or various type of, I think cancer is a type of multiple tissue dividation, mitosis, meiosis. So the most of the important constituents plants of this formulation or their phytochemicals have demonstrated the magnificent anti-carcinogenic properties. Kanchanar Guggul exhibited a cytotoxic effect by inhibiting the cell division. So it is like an anti-mitotic and reducing cell proliferation. So I think Kanchanar Guggul works by inhibiting the cell division, because in tumor and in any type of cancer, the cells dividing, multiplying, and so we have to inhibit the cell division. And due to the property of this Kanchanar or all the constitutes, just Triphala, Trikatu, and all the constitutes really works great in which inhibit the cell division. So it is the best choice of drug for the tumor or any type of cancer or any type of growth. The one more important cancer is breast cancer. I think it is really a bad situation. I just seeing many patients are there with breast cancer. Before some decades, before 20 years, the other cancers are very much seen. But nowadays, I think breast cancer is most probably happening in the females at the age of 35 to at the age of 65. So age variation is there also. So this is caused by, again, the abnormal growth of breast cell. Arbuda or Granthi Samprapti is due to the Vata and Kapha prakop. So the hetus or the reasons are Vata and Kapha dosha. So studies or many researches. I'm not able to give some research papers due to lack of time, but there are many researches, ongoing researches are there also. that Kanchanar Guggul has anti-cancerous properties and thereby helping in the treatment of breast cancer. Kanchanar bark is effectively suppresses the growth of cancer cells. So I think Kanchanar's bark, stem, and all are having the different properties, but bark is really beneficial in all such conditions. So any unusual growth is due to the kapha dosha drushti and involvement of rasa rakta mans meda dhatu as kapha. Raso api shleshma. So rasa dhatu and kapha are connected with each other. Rasa and kapha are having the same properties, and whenever there is a kapha drushti, rasavasrotas is also affected, and rasa dhatu is also having the connection, or kapha dosha is also having the connection with other dhatus like mausa, meda, majja, and shukra dhatu. So whenever there is a kapha prokop, we often see the lakshanas of other dhatu involvement also. So here also we see the rakta mouse meda dhatu involvement in this breast cancer. Next, more important condition, I think nowadays 16 years girls are coming with this uterine fibroids. Uterine fibroids, lifestyle changes or sedentary lifestyle, these are all causes of the uterine fibroids, and these are the non-cancerous lumps growth in the uterus, and these lumps growth increases the complications during pregnancy, and which causes the heavy menstrual bleeding, extreme pain, and infertility. Research has pointed out that Kanchanar Guggul has antiviral, antibacterial, anti-inflammatory, and mainly I think Kanchanar helps to regulate the menstrual flow, and it helps to avoid the blockages. It releases the blockages, or it acts by due to its scrapping action. Due to this scrapping action, inflammation reduces, and ultimately the fibroids goes up with the property of this all the content. So I really seen the various results. Many doctors are there with our this meeting also. They use this regularly, this Kanchanar Guggul in uterine fibroids. So I think this is a wonder drug in the uterine fibroids. One more condition is there. I'm just sharing the experience also, UTI infection, because Kanchanar washes out the debris or the armor or the clay, the particle. So UTI infection is also a type of infection at that point of view that there is a excessive cleda, and this cleda is washed out, or this cleda is removed by the antibacterial property of this Kanchanar, because Guggul is ruksha kashaya, and this ruksha kashaya helps to remove the unwanted substances or the any type of bacterial infection. And so the antibacterial properties that help to cure urine formation problems caused by the urinary tract infections in the woman, and it helps the pain and the burning sensation too. So I think it boosts the functions of the kidney. One more disease, I think it is I always say that it is a like pandemic of in gynecology, PCOD, very common. And this PCOD is a complex condition. It is a genetic, metabolic, hormonal imbalance, and which leads to due to the imbalance like androgens, and due to that irregular ovulation, again it leads to anovulation. And so I think Kanchanar is the best orthogenetic drug. So it could be very nicely helps to remove the conditions like PCOD, because it is all due to the hormonal imbalances. And so I think it really wonder drug for this condition also, PCOD. Next one is menstrual disorder. Kanchanar tree bark and Guggul have a plant steroid that help to purify the blood and the regulate cholesterol and respectively. And this improves the blood flow and helps in the regulating of menstrual cycle of women. So we can give this Kanchanar Guggul in any type of menstrual irregularities, whether they are concerned with the normal menstrual irregulation or they are concerned with the infertility, or we can give in PCOD, PCOS, so all the related conditions. Next one is lipoma, which is a slow growing fatty lump which develops beneath the layer of the skin. And in Ayurveda, lipoma can be correlated with the medosh granthi. Again, the same samprapti is here, that is kapha and ama. And so this ama can develop this toxic remains in the body due to the improper digestion. So we have to correct the agni first of all, as according to Ayurveda literature or Ayurveda therapies, we have to first correct the agni, and then we have to give some such type of anti-inflammatory and immunomodulator drugs. So here also this Kanchanar helps by balancing kapha and deepen pachan, all the other properties also. Next very common condition again is endometriosis. Endometriosis is an abnormal growth of endometrial cell outside the uterus. So here again, whenever there is a growth or any inflammation, kapha doshas, or although there are 3 doshas, but kapha is dominant. So we have to work on the kapha dosha, and vata is also, I think, arthavas srotas is regulated by the vata dosha mainly upon vayu. So we have to correct this upon dosha also. So next one is obesity, which is also a leading disease in the society. Here also the cause is ama. Here also the same pathogenesis and same conditions. So this condition might sometimes even occur due to the constipation, which leads to the imbalance of Meda Dhatu, and Kanchanar Guggul reduce fat accumulation that helps to lekhana and reshape the body and control excessive weight because of its deepen and pachan. Next one is prostatic hyperplasia. Again, whenever there is a hyperplasia, so I think this Guggul is having a triphala and trikatu, which is having a vitamin C. And this vitamin C helps the relaxing muscle of prostate and bladder neck. And this might help in the relieving the pressure and improve urination. So I think this is one more, the reverse or the another condition with this benign prostatic hyperplasia. One more condition, I think this is the rare use of Kanchanar Guggul, tonsillitis. So itis means inflammation. Here again, the kapha and rakta dosha. So we must use this Kanchanar Guggul, which is beneficial in decreasing the signs and symptoms of chronic tonsillitis. Gynecomastia. Gynecomastia in Ayurveda, it is a santalponotta vadhi. It is again due to the kapha dosha. So gynecomastia or mammary gland enlargement, so which is due to the lower testosterone, increased estrogen in males, and many times treatment is not required. It slowly dissolves. But if the patient wants to deal with, because it is hesitating and patient feel awkward with this such type of conditions, so again with the gynecomastia, we have to use with Kanchanar Guggul, because it is also associated with the weight gain. Obesity and weight gain conditions are always associated with gynecomastia. Blocked fallopian is another one more different use of this Kanchanara, because whenever there is a blockage, it is due to kapha rasamamsa kleda, saturation in tube. So you have to use the ruksha, kashai, ushna properties. Like here, Kanchanar is having such all properties, and it helps really wonder due to the trikatu also and triphala. Helps in the absorption of excess moisture and open up the blockage. So contraindications, Kanchanar Guggul may be avoided by the pregnant and lactating mothers. I think there is one question in the chat box. Some doctor is asking about in the pregnant condition, but I think Guggul is contraindicated as it is having a scrapping action, and in pregnancy we have to look for the growth and nourishment. So I don't think Kanchanar Guggul is better choice during the pregnancy. Drug might result in an increase in the LDL in people with excess cholesterol levels. For children, this preparation must be given under medical supervision. Guggul might slow down the blood clotting and results in the excess bleeding in people with clotting disorders. So there are some such contraindications with this Guggul. And cold drinks or anupana. I think these cold drinks are very much important, because see, Bundi is also kasha. It helps to, the same properties are there with the Kanchanar. So Mundi kasha is really great with combination with anupan, because always we suggest the warm water, but instead of warm water, if we give this Kanchanar Guggul with khadir, because khadir is also kashai, ruksha, it helps in the anti-inflammatory and immunomodulator action. Haritaki is the wonder drug, so it will enhance the properties of Kanchanar Guggul. The doses, the normal doses are up to 5 years, we can give half to 1 tablet, and 5 to 12 years, 1 tablet, 12 to 18 years, 1 to 2 tablets, but regular use is that 2 tablets BD for any condition above 18 years. So these are my contact details, and these are some applications which on the Google Play Store. I have published some books also. So these are my books on the Kriya Shari and the research methodology and the gynecology also. So this is all about the Kanchanar Guggul, and thank you very much all the organizations and all the organizers also, Dr. Madan sir, Dr. Harish sir, Dr. Pallavi ji, all the
thank you. Thank you very much. Number one, thank you very much for being with us today. I know you have to look after a whole Ayurveda college as principal, but you found time to be here with us. Thank you very much. Number two, you have taken us into the depths of how the range of conditions where this old and very important formulation is used. And you can see there are several questions about the dosage and all of those things. You addressed some of those issues. From the organizer's perspective, there is a question here, and this is both for yourself and for Anjana ji, which is, if we had to set up a collaboration with our partners here in Toronto. The group here, Canada-India Foundation, is interacting with a local group of hospitals, and it's called the University Health Network, about 5,000 beds in total or thereabouts, and a collection of scientists. Now, your presentation and Anjanaji's presentation, that took us into the heart of how this complex formulation from Bhashyaji Ratnavali is used, and how with confidence you are using this for so many conditions in female health, in male health, in children's health. What do you think is needed now if we want to engage with the doctors, the scientists here in Toronto? What do you think we need to do as a next step?
Sir, I think it should be tried on the cancer patients of lipoma, because I think cancer and lipoma and tumor are very much growing in the society. There are so many patients or cases nowadays.
This is a wonderful suggestion. Thank you for lipomas. And you feel we can shape a program of work with our colleagues here. And okay, so I'm happy to see your confidence. What about the other conditions? Is there something we can do for the other conditions? You gave us a large number of other conditions. Is there something we can do in terms of a small research project?
So it is also useful in the lymph gland, lymphadenopathies also.
Very
Lymph
nice.
gland enlargement and inflammation of the lymph glands.
And
lymph
the
nodes.
last question from my side, there are other questions in the chat box. The last question from my side. People are worried about these complex formulations. One of the reasons for this series of programs that we have is to show people, one, complex formulations. We've talked about earlier in our sessions, we've talked about some complex formulations, some fermented products, and today this very, very important anti-inflammatory, antibacterial, antiviral formulation. Now, how can we show them how you use it safely? Do you have a collection of case studies or something that you have curated over the years? Do you have a collection of cases or something that we can use to start to engage with these people?
We have only personal experiences, not any documented proof is there. And there is no question of any fear. It is all safe, as I have told, that it is only exhibiting some side effects on taking excessive amount, which we do not usually prescribe. So there is no question of any fear, I think so.
Anjanaji, this is a very important point. Yesterday in one of our presentations, I was discussing this about practice-based evidence, which is what you're talking about. You have practice for perhaps hundreds of years. There are people who have used this and they get results, versus bringing it out to people who are looking for evidence-based practice. And this is a conflict. So I will leave it there. And thank you for showing us those opportunities for how we can express confidence and develop some areas of interaction. I open the floor to questions. I think Satish ji has something he might want to add. Satish ji, namaskar.
Namaskar, Madan ji, and thank you so very much, Shilpa ji and Anjana ji, for a wonderful, wonderful presentation. Quickly, for the sake of various audience we are having on not only from the medical fraternity but also a common man. And I think one area where Ayurveda is leading is, as Dr. Madan has mentioned, that yes, lot of evidence in making it into a practice of disease management side, but on the prevention side, I think we are not even touching the potential we have to make this as a part of people's daily diet. As we all know, current kind of a lifestyle, current kind of a eating habits and others, that how these some of key medicines like Guggul, we were talking about Trifla in the past, ashwagandha, and many more, like how these can be part of your daily routine, so that as whatever we intake as part of our dietary, because all toxins which get generated, that gets cleaned on a daily basis. So on that front, if you can share some insight that a healthy person who has no issue whatsoever, how he or she can use Google as a part of their daily routine. Any pros and cons, any kind of a side effects, or what is the minimum doses of making it as a part of their daily routine? That would be very helpful for our lot of audience who are present and listening on the virtual side.
Thank you, Satishji. I don't know if Shilpaji or Anjanaji wants to take this point, a very important point from Satishji, that healthy people, what can they do, perhaps in the context of what we discussed today, or anything else, dinacharya, ritucharya, etc., etc. What is it that we can do to engage with the common man, to guide them about health, what I call health literacy, for instance?
Dr. Madanji, I want to answer the question raised by Satishji.
Please.
For prevention, there are various other methods. In Ayurveda, basically there are two objectives. In first phase, we consider swasthasya swasthya rakshanam. That means to preserve the health of healthy people. That's a preventive aspect. And second part is aturasya vikar prashamnam cha. That means to cure the diseases. And this Kanchnar Guggul is a very serious medicine, and it cures serious disorders, including cancers, including lymphadenitis, as Dr. Anjana mentioned, that it has some side effects also. She said they have observed it caused erectile dysfunction in animals. So that means probably it may be reducing the testosterone level even in human beings. So that is this we need to find out how it is effective, what is the mode of action. Here the scientific community should come forward. Medicines are effective, but now we need to find out how they are effective. We are Ayurvedic practitioners, we are traditional practitioners. We only know how to prepare the medicine, and we know how to use the medicine. We are using, our ancestors were using. Now it is the duty of the scientists, modern scientists, they should develop it. Today, I am glad that Dr. Anjana highlighted that how we were making mistakes by making Google, by putting this one leg, hammering on Google. Rather, we are destroying the properties of Google by using traditional method. She has highlighted that she has developed a method where we can control the disintegration time. I have little experience of pharmaceutical, and the people who are in pharmaceutical, they can understand how serious it is if the disintegration time of a tablet is not complied with the regulations. And it's a serious offense in allopathic side. If the disintegration time of a tablet is not complying with any regulation, then it is considered as a crime. But in Ayurveda, now it is in a developing stage. I think now it's a combination of modern science and the traditional people, traditional knowledge can bring a new science which is needed. And Dr. Anjana, thank you very much for highlighting, and your lecture was very impressive, and I learned a lot from you. Thank you very much. Thank you, Dr. Madanji.
Harishji, we have a question from Ananta Krishnanji, and that question is very important. I would very much like Anantaji to ask this question on the platform, if we could permit Anantaji on the floor. Namaskar ji.
Namaskar. Thank you, Doctor.
Thank you for raising this very important question, sir.
What's important is that while we heard a lot about the empirical efficacy and effectiveness of this medicine, it's also been said that we need to provide scientific evidence-based, proof. So that's where I think Canada provides possibly an opportunity for collaboration, for innovative initiative to see how this can be carried out to a higher level. Yeah. So empirical evidence is important, but we would need, as it was mentioned by everybody else, the scientific evidence as to how it works and what limitations it has. What are the side effects of these kind of things, So one thing is to have case-based approach to it has been good or bad, but I think we need a rigorous scientific approach to establish the efficacy of this product internationally. That means I think maybe we could collaborate with Canadian medical fraternity in this regard. Thanks.
So we look forward to your guidance, as I mentioned to His Excellency Ali. We look forward to your guidance to make these interactions happen. And thank you for raising this important question. There is, of course, the issue of epistemologies. The Ayurvedic thinking is based on one kind of epistemological foundation, and the reductionist experimental approach is based on another kind of epistemological foundation. It doesn't mean they cannot be brought together. They can be, and when brought together, they will be extremely powerful and potent to show how benefits of what we are calling the traditional Ayurvedic medicines can provide additional approaches, ways to human health and well-being. So with those words, I pass the floor to Pallavi-ji. Namaskar, Pallavi.
Namaskar, namaste. I wish to ask a question to Dr. Shilpa regarding Kanchanar, Guggul, and Arogya Vardhani, which is again a very important formulation. It is mentioned that it can be used in combination for certain ailments. So Dr. Shilpa, if she could elaborate on this.
Yes, ma'am. Yes, yes. Because see, Arogya Vardhani also acts on the ama or the toxic substances. Arogya Vardhani is also wonder drug from Agni Manda and Kapha-vata Samprapti. So if we give Arogya Vardhani and Kanchanar Guggul in the conditions like lipoma or breast cancer or any type of tumor, any type of unusual growth, fibroids, endometriosis, and because Arogya Vardhani and the Kanchanar Guggul having the almost some contents are there are some, and the properties are same like ruksha, kashaya gun and ushna gun, which reduces the inflammation. So with combination, it works wonder. It works practically we give many more times, ma'am, in many more conditions, all such conditions, whenever there is inflammation. Yes.
Yeah. One more question was that Satish Thakkarji mentioned that in general, metabolic disorders are very high, especially obesity. So can Kanchanar Guggul be given during the winter months, like say from September to January, these months on regular basis, maybe one OD, one tablet twice a day? Do you think, would you recommend this on?
Ma'am, as per my knowledge, there are no such indications about the season. I think it may be given during all the seasons. And I think as per the health, regular uses, I just suggest one condition or one preparation, like we can use this Kanchanar powder in the kashai as a kashai form, or as a like for gargling purpose. If for the various conditions, we can take this as a glass, one glass of water and 1 teaspoon of this Kanchanar powder, and we may have a gargling weekly or twice a month. So this will improve the oral health conditions. Because it is kashai, so whatever there is some sticky substances and the food debris, it will be washed out easily. So we can.
I was aiming from the metabolic point of view, because our metabolism is very high during Hemant and Shishir Ritu, the winter seasons. Anyway,
I'm getting your point that due to the ruksha guna, I think you are indicating such type of.
Thank you. Over to my
humble my humble submission here is one should take much care of that Guggul resin because it is catabolic as well
Yes.
as anabolic, both in nature. If it is old, then it is catabolic, and if
Catabolic.
it is new or fresh, then it is
It is
anabolic.
anabolic. Right, right.
Yes.
But how to control it? How a consumer can come to know? Because pharmaceutical companies are not mentioning whether it is made from a new Google or it is made from an old Google. How to control it?
This care should take through that physician only. Consumer can't. Consumer can't.
Oh,
So Ayurveda suggests
Yes,
that every Vaidya should make his own medicine.
no. There should be some solution because you are right that new Google is a anabolic, and like if we use a mango, unripe mango and a ripe mango, there's a difference of action. And similarly, it is possible that new Google may be having anabolic properties, and old Google is having catabolic properties. But how consumer will come to know? This is the question. And the second, Dr. Anjana ji, you mentioned that 3-gram Google should be given empty stomach in the morning. Only one time a day. What is the reason?
only one time.
Once a day. But
Because
why don't we split the
because
dose
it is
into?
experience.
Why don't we split the dose into 3 or 4 parts like morning, afternoon, evening, and night? What is the reason why you are preferring single dose of 3 gram?
It is recommended by Sharangdar Samhita, sir. It is classical reference. And it has seen that if it is administered in empty stomach, it gives better result.
Okay. Thank you.
So I think he told it to take in empty stomach only in morning.
Yeah. So, Dr. Madanji, now it's a matter of research. Modern researchers should find out why the Kanchnar Google should be given empty stomach and 3 grams per day is the doses. I think majority of our physicians are not using this high doses. This is one. And second, why it is given early in the morning, empty stomach, and what is the probable mode of action, and what are the side effects, whether it reduces testosterone, whether it is anti-androgenic, and how it is effective in prostate cancer, even in hyperplasia of prostate, benign hyperplasia of prostate. These are the duties of modern researchers. They should find out how these medicines are effective. But there's definitely a scope, there's definitely a potential, and we can provide the public a cost-effective solutions for those diseases which are considered to be incurable in modern medicine, including certain cancers and including certain autoimmune diseases. I think now the time has come. Modern researchers should come forward to look into these medicines. Medicines are effective. They have a history, they have a track record of 5,000 years of usage. But now there's a need to find out from the modern angle. We need to study everything in light of modern science so that we can convince the world, we can convince the entire medical fraternity. Now the time has come. Thank you.
Harishji, I'm taking the liberty to just elaborate on this Aushadhi Seva Kala aspect. I think this is the one area where we need people get confused. Anjanaji, people get confused here, because when we talk about, when we are trying to treat kapha, then the Aushadhi Seva Kala says it has to be done at a specific time. But these are very specialized areas that Kaya Chikitsa people are taught. And hence why we study Ayurveda, hence why we spend so many years, 6 years is undergraduate level and another 3 years to do a MD. And people don't understand this because the image that is given here is just making some tea or grinding some leaves. And then, nobody tells people here that this is a very sophisticated science that has so many details that go in. And this clarification needs to be given. There is a question here. I don't know if I can permit our participants to come on the floor, Harishji. I don't know whether we have a lot of people on the floor here, but I don't know if there is somebody here who wants to add. I can see Rajanji Patangarji joining us from Mumbai, who can maybe elaborate a little bit on Aushadhi Sevkal and the specifics of the Kala. But I know we are running out of time. We have slightly gone beyond our allocated time. But before I go off the floor and hand it over to Pallaviji, I want to thank our two special guests today. Very enlightening and very important to have had both of them. We've had a lovely exchange from them. And I want to thank Anjanaji Bahut Dhanyavad. I'll say this in Hindi and in English. Thank you very much for joining us today. And thanks to Professor C.B. Jha, your mentor, who guides us in many, many ways, many direct and indirect ways. We are very grateful that you have such a wonderful mentor. Thank you, Shilpaji. Bahut Dhanyavad. Very happy that you could join us today and share some of your experiences. All of us will be coming to you, both of you, to see how we can shape this into interactive projects together with Canada. As Ananta Krishnanji said, Canada could be a very important force for shaping research programs. And as Harishji says, there is a need for more research. And I think Anantaji is correct in saying that we need to see and start documenting evidence. So with those few words, I thank all of us, thank all of you for being with us today, finding time. Thank you again. Pallaviji, thank you.
Thank you. Thank you, Dr. Madan. And on behalf of International Ayurvedic League, I would like to once again give my appreciate all those who have participated today. Anant Krishnan from United Nations Norway, I think he has left, but it was wonderful to have him here. And Dr. Ali Said Faki from European Union of Somalia, thank you very much, sir, for your time given. And our special speakers today, Professor Anjana Dwivedi and Shilpa Yerma, it's so kind of you to be here and share your valuable inputs. Thank you very much. And Satish ji, you have always played a very pivotal role in supporting this platform, Canada India Foundation. Thank you very much. And also Consulate General of India in Canada, who have been our partners all through. Canadian College of Ayurveda and Yoga, Dr. Harish Verma ji, a special thanks to you for bringing us all together. And Canadian Ayurvedic Practitioners Association, European Ayurveda Association, Association of Ayurvedic Academy, all of them have been very supportive. Shriman Narendranji, you have been a very crucial person, and thank you very much for bringing in very experts on this platform, and continue your support. Shriman Madan Thangavalu, so nice of you to be here with us and sharing and making these sessions so interactive. Y Media, Pravasi Television, and Tathastu, all of them, thank you very much. Sparing your valuable time is really appreciated from the core of the heart, and Tathastu people. Next week, we are having a talk on Brahmi, that is Centella asiatica. It is called the herb which increases your intellectual ability. So it's also called Manduk Parni, which was popularized maybe by the ancient sage Manduk. So we hope all of you will join us for the next session. Thank you all. Dhanyavad. Happy weekend.
Excuse me, Dr. Pallaviji, the session is on Brahmi Vati. It's a
Brahmi Vati.
Yes.
So Brahmi Vati. Okay. So anyway, Brahmi is the main ingredient.
Yeah,
so it increases your, it is called Buddhi Vardak, and so your intellectual ability is enhanced.
Yes.
Yeah.
Thank you.
Okay.
Thank you.
Thanks for the correction. Thank you all. Enjoy your Sunday.
Thank you.